क्लिक करें no yeah there's a voice I think. Hello. Okay, good morning everyone. Is the voice is clear with you? Okay, let's begin. Today we'll discuss regarding antimicrobials and in the infection control point of view, their classification, um, their mechanism of action and therapeutic uses, and what could be the possible best treatment and their antimicrobial Okay, these are the some outlines of today's discussion: antimicrobial therapy classification, mechanism, therapeutic uses and prophylactic uses of these drugs, adverse effects and complications, some monitoring parameters, mechanism of development of resistance, and classification of antivirals as well. Basically, as we know, microbes are the prokaryotic and eukaryotic organisms, unicellular, invisible to naked eye. That could be a bacteria, fungi, viruses, or protozoa. What are the antibiotics, if supposed to be also called as antibacterials, are the type of antimicrobials drug use and treatment and prevention of any bacterial infections. Ideally, once you start any antimicrobial, before beginning antibiotic therapy, suspected of infection should be cultured to identify the causative organisms and potential antimicrobial susceptibilities of this infection. Okay, in healthcare system, the factors that we have to consider is relevant to the drug, host यानी कि जो patient है और bacteria or infectious agent. इन तीनों के दरमियान में we have to consider the factors like drug with the host. We can go की pharmacokinetic and its toxicity, and drug with the bacteria, the type of resistance that bacteria is going to develop, and bacteria with the host यानी कि patient जो है और bacteria के relationship में infection किस किस्म का है और उसके अंदर कोई defense mechanism start हुआ है या नहीं हुआ. तो ये सारे जो फैक्टर्स हैं हम कंसिडर करते हैं अगर कोई भी पेशेंट इन्फेक्टेड होता है. आई रिपीट अगेन, it's a triangular factor like drug, host and bacteria with the comorbid conditions. यानी कि कुछ पेशेंट्स ऐसे होते हैं जो हाइपरटेंशन होते हैं, डायबिटिक होते हैं, तो this can be a correlation between the infection and the comorbid condition of that patient. कॉमनली एक ये स्नैपशॉट है जिसमें बताया गया है कि व्हाट काइंड ऑफ माइक्रोब्स आर कॉमनली वी कैन अज्यूम if there's a skin flora पे कौन से स्टेफ ऑरियस है, स्टेफाइलोकोकस एपिडर्मिस वगैरह है. रेस्पिरेटरी के अंदर कौन से पॉसिबल हो सकते हैं, लाइक हेमोफिलस इन्फ्लुएंजा है, क्लेप्सिला वगैरह हो सकता है. ठीक है, एंड आल्सो समटाइम्स सुडोमोनास, हॉस्पिटल बग्स वगैरह जो होते हैं. यूटीआई के अंदर अगर यूरिनरी सिस्टम की हम बात करें तो देयर इज पॉसिबिलिटी ऑफ ई कोलाई मोस्ट लाइकली, और अगर एब्डोमेन की बात करें तो देयर शुड बी हेलिकोबैक्टर पायलोरी वगैरह हो सकते हैं. In clinical practice, what kind of the antimicrobial therapy practices, like antimicrobial can be practiced as an empiric therapy, the therapy of infection before specific culture information has been reported or obtained. Usually जब तक हमें कोई infection के culture की कोई information नहीं होती तो हम empiric therapy start करते हैं on the basis of clinical sign and symptoms of the patient and the present illness and past medical history. तो हम एम्पेरिक थेरापी उससे कहते हैं, हम स्टार्ट कर देते हैं एंटी माइक्रोबियल्स की, एंड इट लास्ट फॉर 48 to 72 आवर्स एज अ स्टैंडर्ड। यानी कि 48 या 72 आवर्स पे हमें डिसीजन लेना होता है कि व्हाट शुड बी द टारगेट थेरापी, यानी कि जब तक कल्चर रिपोर्ट हो जाए तो उसमें कौन सा बैक्टीरिया है, तो हम उसको जो है ना एक नैरोइंग स्पेक्ट्रम या सेंसिटिव एंटीबायोटिक उस पेशेंट को स्टार्ट करें। एक दूसरी टाइप है जिस तरह हम कहते हैं सर्जिकल प्रोफाइलेक्सिस। इफ पेशेंट एडमिटेड इन द हॉस्पिटल लाइक फॉर द इलेक्टिव सर्जरीज वो होती हैं जिसमें पेशेंट a little bit stable, और planned surgeries होती हैं पहले से ही कि आपको supposed to be you visit in the hospital, the surgery has planned on this date and this time। तो उसके लिए कुछ सर्जिकल प्रोफाइलेक्सिस की थेरापी होती है जिसमें हम सर्जिकल साइट इन्फेक्शन को प्रिवेंट करने के लिए हम सिलेक्टिव एंटी माइक्रोबियल्स देते हैं। Every institution have on their surgical prophylaxis guidelines, which is given to on the basis of their antibiogram, on the basis of the community image, है ना, कौन से किस किस्म के infections हैं या possibility कौन से surgical site infections हो सकते हैं, तो उसके basis पे surgical prophylaxis therapy दी जाती है। Prophylaxis is a medical prophylaxis therapy to reduce the risk of infections, स्पेशली इम्यूनो कम्प्रोमाइज पेशेंट्स के अंदर, लाइक कीमोथेरापी के जो पेशेंट्स होते हैं या HIV के जो पेशेंट्स होते हैं, तो उनका इम्यूनिटी सिस्टम जो है वो डिक्रीज होता है, दे आर मोर प्रोन फॉर द हाई रिस्क फॉर द इन्फेक्शंस। तो हम उनको एज अ प्रोफाइलेक्सिस फॉर लॉन्ग टर्म और फॉर सिलेक्टिव ड्यूरेशन हम उनको दे देते हैं। टारगेट थेरापी क्या होती है? इट्स अ काइंड ऑफ एंटी माइक्रोबियल थेरापी इन व्हिच वी हैव द कल्चर्स पॉजिटिव विद द ससेप्टेबिलिटी ऑफ द एंटीबायोटिक। यानी कि हमें पता चल जाता है कि पेशेंट को जो इन्फेक्शियस है तो पॉजिटिव एजेंट कौन सा है, लाइक MRSA है तो हम जो है ना टारगेट करेंगे कि व्हाट बेस्ट पॉसिबल टू गिव फॉर दैट पेशेंट। MRSA है तो वैंकोमाइसिन देंगे, यानी कि इफ इट इज सूडोमोनास फॉर एग्जांपल देन वी कैन गो फॉर द सेफ्टाजिडीम इफ इट इज सेंसिटिव। यानी कि ये थेरापी तब स्टार्ट होती है जब हमें बिल्कुल ही क्लियरली वाज़ेह पता होता है कि ये कल्चर ग्रो कर चुका है और उसकी ये सेंसिटिविटीज हैं और ये रेजिस्टेंस पैटर्न है। Synergy therapy in sometimes practices used for the MDR bacteria, MDR जो multi drug resistance bacteria होते हैं, उनके अंदर हम जो है ना synergy therapy possibly that depend on the data available with us कि कौन सी possible synergies effective रहेंगी for particular patient। Okay, if we focus on the classification of antimicrobials, it is classified according to different mode of their properties. Like if we classify on the mode of action, अगर मोड ऑफ एक्शन पे हम क्लासिफाई करें तो हम कह सकते हैं कि कुछ एंटीबायोटिक जो है बैक्टीरियोस्टैटिक होती हैं और कुछ एंटीबायोटिक से ये मुराद है कि टू इनहिबिट द ग्रोथ ऑफ बैक्टीरिया, बैक्टीरिसाइडल से ये मुराद है दे आर गोइंग टू किल दैट ऑर्गेनिजम्स, एंड दोज ऑल दोज एंटीबायोटिक्स they have the action on the cell wall synthesis and protein synthesis inhibitors होते हैं, DNA gyrase वगैरह होते हैं, folic acid synthesis inhibitors वगैरह होते हैं। Later on I'll show you the slide with the full mechanism of action। Another कोई classification होती है that depend on the nature of the drug, यानी कि उसकी जो फिजियोकेमिकल प्रॉपर्टीज होती हैं उसके मुताबिक क्लासिफाई किया जाता है। कुछ हाइड्रोफिलिक होती हैं, कुछ लाइपोफिलिक होती हैं। हाइड्रोफिलिक से ये है कि वाटर मीडियम में वो ज्यादा स्टेबल होती हैं, और जो लाइपोफिलिक होती हैं वो लैटिस मीडियम में या मस्कुलर जो मीडियम होता है वहां पे ज्यादा अपनी पेनिट्रेशन शो करती हैं। अच्छा, ऑन द बेसिस ऑफ PKPD फार्माकोकाइनेटिक एंड फार्माकोडायनामिक रिलेशनशिप के बुनियाद पे क्लासिफाई करते हैं हम इनको टाइम डिपेंडेंट और कंसंट्रेशन डिपेंडेंट। टाइम डिपेंडेंट से ये मुराद होती है कि जितनी एंटीबायोटिक सीरम में ज्यादा देर तक रहेगी तो वो अपना इफेक्ट दिखाएगी, और कुछ ऐसी होती हैं जो एंटीबायोटिक कंसंट्रेशन के साथ जितना हायर कंसंट्रेशन में रहेंगी सीरम के अंदर, वो अपना इफेक्ट दिखाएंगी. Another classification based on the spectrum of activity, यानी कि उनका जो स्पेक्ट्रम होता है, कितने माइक्रोब्स को कवर कर रही है ये एंटीबायोटिक. लाइक वी हैव लिस्टेड द जनरेशंस हैं. पहले पेंसिलिन थी, नेचुरल पेंसिलिन है, फिर सिंथेटिक पेंसिलिन हैं. नाउ वी हैव द जनरेशन 5 जनरेशन ऑफ सेफेलोस्पोरिन. तो फर्स्ट जनरेशन किसको कवर करती थी, थर्ड, फोर्थ, फिफ्थ जनरेशन. तो स्पेक्ट्रम इनका क्या है, नैरो स्पेक्ट्रम, यानी कि लिमिटेड नंबर ऑफ बैक्टीरिया दैट एंटीबायोटिक इज गोइंग टू कवर. एक्सटेंडेड स्पेक्ट्रम यानी कि थोड़ा सा ज्यादा होगा, ग्राम पॉजिटिव एंड ग्राम नेगेटिव. ब्रॉड स्पेक्ट्रम, most of the bacteria, infectious bacteria, that antibiotic will cover. So on the basis of a spectrum of activity, they are classified in three: narrow, extended, and broad spectrum. There's another chemical classification, moiety, जो उनके chemical structures वगैरह होते हैं, तो उसके मुताबिक भी classify किया जाता है. जिस तरीके से जनरली हम कहते हैं कि बीटा लैक्टेम्स हैं, लिंकोसिनामाइड है, अमाइनोग्लाइकोसाइड, क्विनोलोन्स हैं, जिनको यूएलिफ्लोरोक्विनोलोन्स भी कहते हैं, मैक्रोलाइड्स, टेट्रासाइक्लिन एंड ग्लाइकोपेप्टाइड्स वगैरह हैं, ओक्साजोलेडीन्स हैं, सल्फोनामाइड्स हैं, रिफामाइसिन एंड मिसलेनियस ऑन दैट. Okay, if we talk about regarding pharmacokinetics of antimicrobials, जनरली अगर हमें पता होता है कि कोई भी अद्वियात अगर हम लेते हैं, antimicrobials ले रहे होते हैं, तो this drug has to pass from the systems of the body. Like अगर orally ले रहे होते हैं तो उसकी absorption कैसे है, distribution, metabolism कैसे है, और उसकी excretion किस route से हो रही होती है. तो दिस इज लिटिल अबाउट फार्माकोकाइनेटिक. लाइक आईवी ड्रग्स जो होती हैं, इंट्रावीनस हम देते हैं, तो वो 100% ब्लड में रीच करती हैं. जो अगर ओरली ड्रग्स, ओरली एंटीबायोटिक्स लेते हैं, तो वो उनमें से कुछ पोर्शन, कुछ फ्रैक्शन जो है वो ब्लड में रीच करता है. एंड ऑल्सो दैट डिपेंड ऑन दी आईवी टू पीओ जो हमारी एक्टिविटी होती है, तो उसको हम मद्देनजर रखते हुए कि उनकी बायो अवेलेबिलिटी कितनी है, तो उस हिसाब से हम स्विच करते हैं पीओ पे. कुछ अद्वियात ऐसी, कुछ एंटीमाइक्रोबियल्स ऐसे होते हैं दैट नीड टू बी क्लियरेंस फ्रॉम द लिवर, सम नीड टू बी क्लियरेंस फ्रॉम द रीनल फंक्शंस. अगर कोई रीनल फंक्शन जो है ना काम नहीं कर रहा, तो देन वी हैव टू थिंक द क्लिनिकल फार्मासिस्ट और द हेल्थ केयर प्रोफेशनल, प्रिस्क्राइबर, डॉक्टर्स, they are going to adjust the dose for that antimicrobial according to the creatinine clearance of these antimicrobials. Okay, this is a slide that's showing the mechanism of action of different class of antimicrobials as we discussed. Like beta lactams हैं तो वो सेल वॉल के ऊपर काम करती हैं, और पोलीमेक्सिन्स वगैरह हैं तो सेल मेम्ब्रेन के ऊपर काम करती हैं. अगर सल्फोनामाइड्स हैं तो वो फोलेट सिंथेसिस पाथवे के ऊपर काम करती हैं. लाइक न्यूक्लिक एसिड सिंथेसिस में हमारे पास जो है ना क्विनोलोन्स आ जाएंगे, रिफामाइसिन वगैरह आ जाएंगे. प्रोटीन सिंथेसिस के अंदर हमारे पास मैक्रोलाइड्स हैं, क्लिंडामाइसिन, लाइनिजोलेट वगैरह, ये इसमें आ जाएंगे. अमाइनोग्लाइकोसाइड्स आल्सो पार्ट ऑफ दिस प्रोटीन सिंथेसिस, and 38 subunit and tetracyclines as well, the same action. Okay, the first class we'll just go through the penicillins. As we know, it's discovered in 1928 and most likely 1942 by the Alexander Fleming. That's observed from the fungal species mold and genus Penicillium notatum. It was introduced first in 1940. Penicillins have the bactericidal effect. It means they are going to kill the bacteria, kill wide variety of bacteria. It's also known as chemically beta lactams because they contain the beta lactam rings. If you see on this slide, there's a structure in the red quadro structure. It's a beta lactam ring, which is very common in the class of beta lactams of different class of antibiotics like penicillins and cephalosporins हैं, और कार्बोपेनम्स वगैरह हैं, तो उनका जो सेंट्रल स्ट्रक्चर है उसमें ये रिंग कॉमन है। अच्छा, दीज आर द क्लासिफिकेशन फॉर द पेंसिलिन्स, जिस तरह हमने पहले भी डिस्कस किया था। इट्स अ नेचुरल पेंसिलिन, कुड बी अ सिंथेटिक पेंसिलिन। नेचुरल पेंसिलिन में पेंसिलिन जी और पेंसिलिन वी व्हिच इज ओरल फॉर्म। सिंथेटिक पेंसिलिन्स में हमारे पास एंटी स्टेफाइलोकोकल पेंसिलिन्स हैं, अमाइनो पेंसिलिन्स लाइक एमोक्सिसिलिन वगैरह है और एम्पिसिलिन। एक्सटेंडेड स्पेक्ट्रम पेंसिलिन्स में हमारे पास जो है ना, कार्बोपेनम्स में मेरोपेनम वगैरह ये चीजें आ जाती है। Okay, this is a little detail for the action of penicillins. Like they have to penicillins enter in the bacteria via the cell wall of that bacteria, and inside the cell they bind to penicillin binding proteins. जो सेल वॉल के ऊपर वगैरह होते हैं तो उसके ऊपर वो बाइंड करके और सेल वॉल इनहिबिशंस करते हैं, एंड इन द लास्ट द लाइसिस ऑफ दैट बैक्टीरियल सेल। तो इसी तरीके से वो साइडल एक्शन इसका शो होता है। This another scratch. If you see the difference between gram positive and gram negative, gram positive, if they have the peptidoglycan layer over there, and gram negative, they have the layer as a lipoprotein layer in addition of that. So outer membrane also there. That's why if you consider this pictogram, this will show more difficult entry for the gram negative microorganisms as compared to gram positive. पेंसिलिन्स के साइड इफेक्ट्स क्या हो सकते हैं पॉसिबली? वन इज एलर्जिक रिएक्शन, एनाफाइलैक्सिस वगैरह। जस्ट वन मिनट। Just hold a second, please. Excuse me. There's an issue in the network, I think. No, somebody has raised their hand and they were saying, yeah, oh, just one. Okay, we were discussing for the penicillin adverse effects. Penicillin, some patients might experience the drug fever. Some patient might experience the gastric effect, like penicillin-induced diarrhea. जिस तरह augmentin अगर आपने सुना हो, there's a amoxicillin with clavinic acid. किसी पेशेंट को चल रहा होता है कि कुछ पेशेंट्स पीड्स में या अडल्ट में वो डायरिया की कंप्लेन करते हैं। Hemolytic anemia on the higher doses with the ampicillin could be possible, and there's some allergic reactions as we discussed earlier. Before giving penicillins to the patient, is better as a standard that we should ask them that if the patient is allergic to penicillin or no. If it is allergic to penicillin, we'll go for the another antimicrobial class to be treated for that patient. Acha, there are some combinations for the penicillins, like penicillins with the beta-lactamase inhibitors. Beta-lactamase inhibitors क्या होते हैं? These are the some added class of antimicrobials which help to stabilize the penicillin for the mechanism of action. क्योंकि आपको पता होगा कि ESBL आपने सुना होगा, extended spectrum beta-lactamase, यानी कि कुछ बैक्टीरिया ऐसे होते हैं जो ESBL प्रोड्यूस करते हैं, लाइक ई कोलाई वगैरह है, क्लेप्सिला वगैरह है। तो अगर वो ESBL एंजाइम प्रोड्यूस करते हैं For those supposed to be, it was generated with the combination of penicillins and beta lactamase to inhibit such kind of enzymes. Like what kind of preparation that we have currently in the market, like amoxicillin with the clavinic acid, ticarcillin with the clavinic acid, piperacillin with tazobactam, ampicillin with the sulbactam. Some of example are there, and also we have the formulary like amoxicillin with the clavinic acid and piperacillin with the tazobactam. Acha, one class which is frequently used in the hospital system, it's the piperacillin tazobactam. It's a combination of beta lactam penicillins with the beta lactamase inhibitors with a strength of 4 gram plus 0.5 gram. This produce action on a time dependent killing effect. As we discussed earlier, कि time dependent वो होता है कि जितना prolonged infusion होगा और दिस मेडिकेशन जितना जो है ब्लड के अंदर ज्यादा अरसा रहेगी तो वो अपना इफेक्ट अच्छा दिखाएगी एज कंपेयर टू शॉर्ट इन्फ्यूजन टाइम. It covered the following possible organisms. Staph aureus MSSA को कवर कर सकती है and Acinetobacter if it is sensitive there, and bacteroids anaerobes को कवर कर सकती है, and also variety of other organisms like Pseudomonas है, like E. coli वगैरह उनको कवर कर सकती है. Most likely this can be used for the hospital app और web में use कर सकते हैं. Intra-abdominal infections में diabetic foot infection के अंदर हम इनको use कर सकते हैं. In some cases the longer courses can be gone through like 2 weeks या 2 weeks से ज्यादा हम कर सकते हैं. But usually for the CAP, it's a short course therapy. 3 to 5 days के लिए is sufficient for the hospital admitted patients. This drug, this class of antibiotic have a good penetration in the lungs, intestinal mucosa, uterus, ovary, interstitial fluids वगैरह. इसमें biles के अंदर इसकी good penetration है. So that can be good for such kind of infections. And this microbial have a poor penetration in the CSF, so could not be the good choice for the meningitic cases. This go through the excretion through the renal function. If there's a decrease in renal function, so we are going to adjust for the doses. The half-life increases 2-fold for the piperacillin and 4-fold for the tazobactam in expected GFR less than 20 minutes per 20 ml per minute. As we know, some antimicrobial have some interactions to decrease or increase effects. Like if this drug can be given with the vancomycin, there's a risk for the renal toxicity. There's a risk for the rise in creatinine level of that patient. Okay, इस क्लास ऑफ एंटीबायोटिक्स से हम क्या मॉनिटर कर रहे थे? अगर किसी पेशेंट के ऊपर ये चल रही है, वी मॉनिटर द क्रेटिनिन लेवल्स, सीरम क्रेटिनिन वगैरह, सीबीसीज मॉनिटर कर रहे होते हैं, पीटी आईएनआर मॉनिटर कर रहे होते हैं, बट नॉट फ्रीक्वेंट एज अ बेसलाइन एंड देन वीकली फॉर द लॉन्ग टर्म कोर्सेस. द अनदर थिंग, सम formulation of this antibiotic contain the 9.4 millimole or 217 milligram of sodium. So we have to go through with the cautious if a patient with a hypernatremia या कोई ऐसे पेशेंट्स होते हैं जिसमें जो है ना पहले से ही सोडियम लेवल हाई होती है, तो then we clinically sometimes decide that we should start with this antibiotic or we have to change to other antibiotic to cover as a direct therapy or targeted therapy. These were the strength as we discussed, the formulation strength, and the doses in peds supposed to be 100 to 300 milligram every 8 hours should be given and infuse over 30 minutes or infuse over a prolonged infusion. The dilution, it can be compatible with the normal saline and dextrose water. Another class of beta lactams supposed to be cephalosporin. If you see, this is a table for the cephalosporin. के फर्स्ट जनरेशन में कौन से हैं, सेकंड जनरेशन में कौन से हैं, थर्ड, फोर्थ, फिफ्थ जनरेशन एंड द कॉम्बिनेशन. If we see with the red marking, these are the formulary with us, and the other one is available in the market throughout the globe. If we see the coverage for the first generation, they have the good gram-positive coverage and a little bit gram-negative coverage. And if you see the second generation, they have the good gram-negative coverage with the gram-positive coverage. If we'll go for the third generation of cephalosporin, they have the good, better coverage for the gram-negative microbes, and they have the less coverage for the gram-positive bacteria. The fourth generation as equal, they have the good gram-negative coverage and a little bit lesser gram-positive coverage as well. And also they have the beta-lactamase stability as well. Fifth generation, it's an advanced generation which can cover some gram-positive and gram-negative as well. And the good stability for the beta-lactamase inhibitors. यानी कि इसमें से थर्ड जनरेशन में से we'll see in the further slides what kind of coverage every class that have. These are basically the semi-synthetic derivatives from the fungus, and their action is same as we discussed for the penicillins, and they have the bactericidal actions instead of bacteriostatic. They are divided as we discussed earlier slide. They divided into classes according to their antimicrobial activities. Like first generation uncomplicated skin and soft tissue infections के अंदर safely use की जा सकती है to cover the staphylococcus and streptococcus. Usually these agents are cefalexin oral form में है, cefazolin is a IV form, which given usually for the surgical prophylaxis for the कार्डियोथोरेसिक सर्जरी ऑर्थोपेडिक और इंट्राएब्डोमिनल सर्जरीज वगैरह उनमें एज अ सर्जिकल प्रोफाइलेक्सिस प्रिस्क्राइब की जाती है. Second generation cephalosporin, as we discussed, they have the gram-negative bacilli cover and gram-positive cocci as well. So they are available in the IV form and oral form as well. So they can be used for the intra-abdominal surgeries as well, and skin and soft tissue infection, or any diabetic foot infections where we suspect a little suspicious of gram-negative to be covered for the elective surgeries. ओके थर्ड जनरेशन में हमारे पास जो एंटीमाइक्रोबियल्स हैं लाइक सेफ्ट्रैक्सोन, सेफ्टाजिडीम, सेफोटेक्सिम एंड सेफिक्सिम. Cefixium is the oral form which can be a replacement once we switch from IV to oral. If patient on IV third generation cephalosporin, if we want to switch on oral, then we can switch on a Cefixium to have a equal efficacy for that one. It can be used for the febrile neutropenia patient, typhoid fever. It can be used in the complicated UTI. It can be used otitis media. It can be used for the gonorrhea and some upper respiratory and lower respiratory tract infections. With the doses given 8 milligram per kg per day for the peds or in the divided doses. Okay, ceftriaxone, another example for third generation cephalosporin. It's a broad spectrum, gram-negative cover, and has a lower efficacy against gram-positive organisms. But keep in mind that this third generation cephalosporin does not cover Pseudomonas, because ceftazidime is a drug of choice which is covering Pseudomonas bacteria. The indication for ceftriaxone can be prescribed for the community-acquired pneumonia in a hospitalized patient, like lower respiratory tract infection, skin and soft tissue infections के अंदर use हो सकती है, UTI में, bone and joint and meningitic infections के अंदर use हो सकती है. This is a strength. It available in 1 to 2 gram strength, and these are the doses. If you want to give non-meningitic doses, then it should be a 50 to 75 milligram per kg once daily, or in divided doses. Meningitic doses, जिसमें हमें the drug has to penetrate and cross the blood-brain barrier to produce effect in the meninges. So it can be given 100 milligram per kg. These are the compatible dilutions, like diluted in normal saline and dextrose 5%. There are some special considerations that this antimicrobial is not compatible with the calcium containing products like Ringal lactate solutions वगैरह है तो उसमें avoid करते हैं because it's going to precipitate there, so can harm to the patient while administering IV route. So it should be given in the dextrose 5% or sodium chloride. Then we have fourth and fifth generation cephalosporin, fourth generation for pneumonia, empiric therapy for the febrile neutropenic patient, complicated intra-abdominal infections के अंदर. It can also cover the pseudomonas. The example for fourth generation is the cefepime. And the fifth generation is the latest generation cephalosporin that can be covered for indicated for the pneumonia and complicated skin and soft tissue infections. It has, this is the only fifth generation cephalosporin which is active against MRSA. So this is the big advantage for the cephalosporin fifth generation, which is active against the MRSA. The example from the fifth generation which is active against MRSA is ceftaroline. Okay, there are some adverse effects or side effects of these antimicrobials, such class of antimicrobials, diarrhea वगैरह, hematological changes हो सकती हैं, might experience for the eosinophilia. In some patients might they can go for the thrombocytopenia वगैरह, और अगर long term में use होता है तो interstitial nephritis can cause, which is renally excreted third generation cephalosporin. On higher doses, like we have example for cefepime, if it is given 2 gram Q8 hours on higher doses, there's a chances for the seizure-like activity in those patients. Then we have another class. This is carbapenem class. If you see the class from the antibiotics from this class are meropenem, ertapenem, dori, and imipenem with the cilostazine. And the recent generation with us is meropenem with viborbactam, imipenem with the relibactam. Okay, what are the properties of carbapenems? These are very much broad spectrum and first introduced in 1970s. It's also sourced from the fungal Streptomyces cattleya, and they have the time dependent effect, as we discussed earlier, time over MIC. If they are giving in a prolonged infusion in adequate doses, they can produce good effect against the infection. And these are the bactericidal activity. They have the bactericidal activity of carbapenems. Okay, among carbapenems, we keep in mind that there's a one drug known as ertapenem, which is not used against pseudomonas because it doesn't cover. It's the only carbapenem which is not covering the pseudomonas. Otherwise, the meropenem, imipenem can cover the pseudomonas infections. All the carbapenem have the interaction with the valproic acid to reduce the valproic acid concentration. अगर कोई पेशेंट जो है वो सीजर्स या एपिलेप्सी का पेशेंट है और valproic acid के ऊपर है, और अगर वो पेशेंट हॉस्पिटल में एडमिटेड है और वो कार्बापेनम स्टार्ट करना चाह रहे हैं, तो there's a risk for chances for the breakthrough seizures in that patient because carbapenem is going to decrease the valproic acid level by 60 to 70%. So ultimately, these class of antibiotics are going to decrease the level of valproic acid. So they can produce a subtherapeutic effects for the epilepsy. It's indicated because it's a very broad spectrum antimicrobial class. It is indicated for the MDR bacteria in the hospital or opportunistic infections, XDR bacteria in the hospital, lower respiratory tract infections के अंदर है, intra-abdominal में UTIs के अंदर, serious illness like sepsis के अंदर as a empiric therapy we can use, and the skin and soft tissue infections. One example, this imipenem with the cilostazine. The doses are 15 to 25 milligram per kg per dose is given. and these require some renal adjustment. If the patient renal function is decreased, GFR decreased, then we are going to adjust the doses for. And among the carbapenems, the unique activity for imipenem is that might be there's seizures effects more frequent as compared to other class of this carbapenems. Like imipenem, जो patients imipenem के ऊपर हैं, तो उनको शायद seizures activity ज्यादा हो सकती है as compared to others. Another example of this class is meropenem, usually given non-meningitic doses 20 milligram per kg per dose in pediatric patient, while in adult patient we are directly giving 1 gram q 8 hours in a normal renal function. While meningitic doses में हम double dose करके दे देते हैं. Another class from antimicrobial is the macrolides. The example from the macrolides class of antimicrobial are azithromycin, clary, and erythromycin. Because as we discussed earlier, they are binding to 50S ribosomal subunits, and they have the variety of uses. If you see on a snap, they can be used for the respiratory tract infections, they can be used for the STDs, they can be used for some atypical cover in the respiratory tract infections. And then they can be the last line agents for the, like azithromycin is the only oral form currently available in Pakistan for the XDR typhoid. If we see for the macrolides drug induced effects वगैरह, तो patient को GI effects experience हो सकते हैं, nausea, vomiting वगैरह. अगर patient जो है long term पे और higher doses पे है, so there's a chances for the QT prolongations, and these are the things supposed to be we have to monitor in respective patient who's on macrolides, especially on azithro and clarithromycin. Another class supposed to be glycopeptides. इसके अंदर hospitals frequent use drug in the hospital is a vancomycin, to basically covered to treat MRSA infections if patient have. This drug is a narrow therapeutic index drugs because it gives us the concentration, it's achieved for the levels for vancomycin. It's active against only gram-positive bacteria, and the protocol for vancomycin is that whosoever on a patient on vancomycin should take in the trough levels or AUC or MICU ratio for the further dose calculations. Usually dosing is 2 gram, either in divided or in every 12 hour or every 8 hours, we can give maximum 2 gram q 8 hours. As we know, it's a high molecular weight drug, and it can produce some nephrotoxic effects in the patient, and it can produce some infusion-related effects. Since this drug required the therapeutic drug monitoring, so we can go for the trough levels before the 4th dose as a standard. Another class of antimicrobial is the tetracyclines. We have one example from this class is tigecycline. Is a very broad spectrum antimicrobial which can cover MRSA, MRSA, and it's not active against the Pseudomonas. Supposed to be this class of this drug of this class is considered as the second line agent or the last line option to treat the infections. By nature, this drug is lipophilic in nature, so the concentration of the drug in the blood is less for this medication, so it's not suitable for the bacteremia. If there's a blood infection, so tigecycline is not suitable for that. But its therapeutic uses is intra-abdominal infections, for pneumonia can be used, skin and soft tissue infections के लिए बहुत better option. If there's a MDR, एसिनेटो वगैरह हैं तो उसके लिए better option. Usually dosing is we are giving as a 100 milligram as a loading dose and 50 milligram Q12 hours. And for this drug, we have to monitor the liver function periodically, and we have to observe the sign and symptoms of anaphylaxis on a first dose. The other adverse effect might be possibly patient may experience some GI effects frequently, nausea and vomiting, and some patients may experience diarrheal conditions. And also, अगर patient को acute pancreatitis है, तो it's not recommended to administer this drug because it will worsen that condition. It can worsen that particular condition. Another class that we have, nucleic acid synthesis inhibitors like sulfonamide, that one drug supposed we will discuss is a cotrimoxazole. It can be used for some skin and soft tissue infections. There are some IDSA guidelines says to be used for the cystitis, UTI, and it can be diluted in a dextrose 5% only. It cannot be diluted in the normal saline. Once the patient on the cotrimoxazole, the special consideration, we have to monitor for the hyperkalemia, hyponatremia, and some folic acid decrease. Okay, another class of these antimicrobials are quinolones. Generally, these are the bactericidal activity drugs, antimicrobials, and they available in the IV form as well as in the oral form. And these are the good options for the Pseudomonas infections to be given as oral. And other therapeutic uses for such kind of antimicrobial class is lower respiratory tract infection, bone ये होता है कि if we have given for the short term course of 5 days or 3 days, the patient might have some effect for another 1 or 2 days. The drug is available in the body to produce action. Example from this class like ciprofloxacin, with these doses we are giving 10 milligram per kg, and in per oral cases supposed to be we are giving in peds 10 to 20 milligram. And in adult, we are giving directly 5 milligram, 500 So we counsel them that their interaction with the calcium or iron chelating agents or antacid result in decrease in effect of this drug. So अगर कोई patient ciprofloxacin के ऊपर है तो हम उसको counsel ये करते हैं कि you have to keep 2 to 3 hours gap before and after administration of this drug. Another example that we have levofloxacin. It's an advantage to be given as a once daily as compared to ciprofloxacin, which is giving twice daily. And these are the doses that supposed to be we can give 8 milligram per kg in peds, and in adult 500 to 750 milligram once daily. And they have the same indications as we discussed generally. Generally, the adverse effects of quinolones, like they can cause seizures on higher doses. They have some the drug induced diarrhea. They can cause the QT prolongation, and in the child population they can cause the tendon rupture. And if patient is with a history of, or the patient comorbid condition of myasthenia gravis, if fluoroquinolones are used with in that patient, they can worsen that disease condition as well. Another antibiotic that we discuss here, metronidazole. Usually, this drug has amibicidal action, also as an antibiotic for the anaerobes and anti-protozoal drug. And this can be given with the doses of 40 milligram per kg per day IV in divided doses, or 15 to 50 milligram per kg per day in a PO doses. Patient, this can be used as an adjuvant treatment. This can be used for the standard treatment for the tetanus infections, for H. pylori as an in combination, and some bacterial vaginosis infections are there. This can be used as a empiric therapy, as the prophylaxis therapy for any suspicious of anaerobes involved in the infection. Those patients who's on metronidazole orally, they might experience a metallic taste. And on a long term, we have to monitor for the hepatic function and leukopenias in some cases. There's another class, aminoglycosides. Aminoglycosides produced from the streptomyces, and also they have the bactericidal effect, and they kill most gram-negative bacteria, and they have also some gram-positive activity in combination. Therapeutic uses के अंदर they can cover Pseudomonas, E. coli, and Proteus species infections, and for the Klebsiella. The agents from this class, like that, we have gentamicin, tobramycin, and amikacin. These also are some highly molecular structure drug. So there's a chances for the nephrotoxicity and ototoxicity in a long-term use. And we have to monitor for the renal function while those patients on aminoglycosides. This example, 15 milligram per kg per day in divided doses or once daily doses that we are going to give to the patient. And IV administration जो है वो 30 to 60 minutes में we have to monitor the renal function and dose done according to that. As we discussed earlier, this class of antibiotic are the concentration dependent effect. So we have to monitor the peak and trough level of these drugs. This required therapeutic drug monitoring. And there's another snap of that aminoglycoside in various infections. MRSA pneumonia के अंदर use हो सकता है, UTIs के अंदर, skin and soft tissues के अंदर, if it is susceptible is there. Another class of antimicrobial is linezolid. Is a member of oxalidiones class, and it's active against aerobic gram-positive bacteria. It's a good alternative for the MRSA and VRE, vancomycin resistance enterococci. There are some indications as a second-line agent to be used instead of vancomycin resistance cases, are in those cases that we cannot give vancomycin. It's a last-line option supposed to be available to be used. These are the dosing information: 10 milligram per kg, IV or oral. We can give every 12 hours or every 8 hours in some cases. So the other good thing is that this antibiotic is in IV form and oral form, they have the equal bioavailability. If the patient is stable in the hospital, so we can easily switch from IV to oral to produce the same effect. On the long term, supposed to be what we have to monitoring, they can cause such kind of antibiotic is going to cause thrombocytopenia. In some cases, some patient might produce some diarrhea and headache, and they have the might produce peripheral neuropathy on the higher doses and on a long-term treatment. Another class cell membrane inhibitors जो हैं polymyxins, जिसकी example है colistin. It's originated from about 4 to 5 decades initially and used for the Pseudomonas, and the colistin also known as polymyxin E. It exerts both concentration dependent bactericidal effect. It's also a last line agent, and it's only used for the gram-negative cover and for the MDR or XDR gram-negative bacteria in the hospital system. Like we have examples, koi MDR Pseudomonas hai, ya MDR Acinetobacter कैम्पिलोबैक्टर और ESBL E. coli CRE के जो इन्फेक्शन होते हैं, जो कार्बापेनम से रेजिस्टेंस होते हैं, तो उसमें हम ये यूज कर सकते हैं. अदरवाइज इट्स नॉट फ्रीक्वेंट ड्रग टू बी यूज.